not sure if Marilyn's going to join us. If she does, I'll ask the Sam. I'd just like a couple of minutes to talk about another possible issue we could look at.
Sure. Okay. Okay, I think we are ready to go. Good evening, everyone. I'd like to call this meeting to order for today, November 4th, 2024. This is a special virtual meeting of the Health and Human Services Committee for Monday, November 4th. My name is Councilman T.J. Clark. I serve as the committee chair and also the assistant majority leader for the City Council. And I'm joined by my esteemed colleague, Councilman John Gale, who is a voting member. And we have a packed agenda tonight. And so we're going to move very expeditiously. And it looks like we are joined by our Director of Health and Human Services, Ebony Jackson Shaheed, our Corporation Counsel, Attorney Damar Osborne, and we are viewing live from HPA-TV.org on our social media channels at HPA on Facebook, on YouTube TV, as well as channel 96 on Comcast and Xfinity, and channel 6032 on Frontier. And so we're going to get started. So we're going to go in order. Item 2.1, Mayor Awolampalam with accompanying resolution confirming the appointment of Martha Ann Kingsley to the Refugee and Immigrant Affairs Commission. And Martha is here. And if I have pronounced your first name, please forgive me, and please let us know how to properly pronounce it.
Marthe is correct. Marthe is a French name. The E is silenced, but we say Marthe.
Thank you, Marthe. Welcome, and please let us know a little bit about yourself and why you are stepping up to the plate to look to be a member of our Refugee and Immigrant Commission.
Sure. Originally, I'm from Côte d'Ivoire, west part of Africa. And I had the education background over there. I was a master holder in public relations before coming. But we were forced to come here because of my husband's health. It's a long story. I won't go deeply. So when I came here in 2014, it was like a new beginning because of the language barrier. So I needed to go back to school. I went back to school at Goodwin University, where I got my bachelor in organizational management and leadership, and I got at the same time my master's. And I'm currently pursuing my doctorate degree in the same major. So why I would like to serve others? I was a refugee myself. And later on, I worked in 2 agencies, IRIS and Catholic Charities. So having been in these 2 positions, mean somebody who was needed help and now somebody who is providing help, I'm in a position that I understand better these refugees and immigrants. And also my main objective and purpose is to let others feel better and mostly help them transform themselves. Because sometimes when they are coming from, they lost everything and they needed attention. And working with them, with 2 agencies, I understand more being in the position. So this is my main objective: help people feel better and feel transformed, motivate them to in their new homeland, because sometimes it's not easy. It's not easy. I've been across a lot of them who sometimes they want even to give up everything and go back. This is my story.
Thank you very much for your story and letting us know a little bit more about you and your passion. Councilman, you have any questions?
Sure, or comments perhaps as well. First, let me just say I love your accent, and there's no way I can say
French.
Côte d'Ivoire quite as poetically as you do. So, uh, have you had the opportunity to sit in with the commission and watch some of their meetings and some of their be aware?
Yeah,
Yeah. Okay. Okay.
I've been, yeah,
I don't know. You weren't with the group that came to city council recently.
yes,
You were.
yes.
Wonderful, wonderful, wonderful. Well, thank you then again for being willing to step up and participate
My pleasure.
in the commission. And um, you know, we certainly speak on behalf of everybody on council. We appreciate folks who are willing to take time from their busy schedules to participate in these on a volunteer basis. And we all look forward to doing what we can in our own way to make life here in Hartford better for everybody. So just want to extend my thanks on that regard.
Thank you, Councilman. I don't have any questions, just a comment. Thank you again for your willingness to serve, and do look forward to working with you and assisting the rest of the commission members to help advance your recommendations on regarding what you think we need to do regarding the refugee and immigrant community. So with that said, the chair will entertain a motion.
I move that we send Ms. Kingsley's nomination back to council with a favorable recommendation.
Motion has been made and I'll second that. Been properly second. In a discussion. If there's none, all in favor indicate by saying aye.
Aye.
The ayes have it. This item is passed back to council with a favorable recommendation. Thank you very much. Congratulations, and we look forward to working with you.
Thank you so much.
Right. Next up is item 2.2, Mayor Arulampalam with a company resolution confirming the appointment of Naomi Njoma to the Refugee and Immigrant Affairs Commission. And we have Naomi here. And please, if I have mispronounced your last name, please let me know and correct me so I can be able to properly pronounce it.
Yes, so it's Naomi Goma and it's
Oh my,
silent.
the N is silent. Okay. I should know better.
It's okay. It's okay. I've heard all kinds, so it's cool.
At least I was close. Please
Yeah.
proceed. Let us know a little bit about yourself and why you are interested in serving on the commission.
Okay, so like Marth, I am a new African American. I was born in Congo, lived a lot of my whole life in Kenya. So I am Kenyan and Congolese and American, and I home in the U.S. is New York, but I did move here about 8 to 10 years ago. Lived in Hartford for a little bit, worked in Hartford as well, was a juvenile detention officer, and then moved into another role, which is at Emmanuel Lutheran Church. And I moved out of Hartford for like a little bit, and then I moved back. I bought a house in Hartford, and there is this need. I fell in love with Hartford, but I felt like I could give back my talents, which is so in my current role, I do work with immigrants, refugees, and undocumented, and I feel like I could help out a little bit more by joining the board, and for someone who has direct services working with people, I think I bring a wealth of information and maybe ideas. And also that I do speak 5 languages, so translation. So that is one of the things. So I'm hoping that what I do at Emmanuel Lutheran Church will be an extension and just give back to the city that actually loved me back.
Excellent, excellent. Thank you. Councilman, questions, comments?
Sure. Listening to you brings to mind the joke, what do you call a person who speaks only one language? An American.
I've never heard of that one, but it's a funny one.
It's so intimidating, you know, your ability to speak so many languages. I'm always in awe. You know, I took a lot of French in high school, but being able to say Côte d'Ivoire is about as good as I can get.
Yeah, like in my country, we have 63 languages. I speak,
63.
I speak about 4.
My goodness.
Yeah.
The other thing, you know, not just as sort of an aside, it's just interesting. Your last name spelled NG, but with the silent N, so Goma, and we have a large Southeast Asian population in Hartford, Vietnamese in particular, where you have a lot of last names that begin with an N that's silent. Nguyen, Nguyen, and Ngo, and you know, so it's
Yep.
2 different parts of the world, but coming with somewhat similar.
I've actually found out that we have a lot of similarities in terms of like food and culture and morals. We're not that far away from each other.
Must be that Indian Ocean that just things crossed
Yeah.
Must be.
over time.
Yeah.
So, you know, same comments that I made with Ms. Kinsley, you know, certainly appreciate your willingness to step forward. And it, you know, it sounds like both of you have wonderful backgrounds and a tremendous amount to add to the mix here to, you know, help us in Hartford become that city that loves you, as you so wonderfully put it, that we can be that city that loves everybody. That
Yes.
comes here, and in return they love us back. So, thank you. Nothing further, Mr. Chair.
Thank you, Councilman, and you know, thank you for you stepping up to the plate to serve our community. It's been a while since I've spoken French, and actually, when I took a trip to Africa this summer, I was in Morocco, and I was trying to speak French. I think we were in Fez, where they speak French, and I did pretty good. I did pretty good.
Nice.
We
Oh.
we want you to say something in French.
You stepped into that, Mr. Chair.
Oh, what can I say?
Bonsoir.
I'm sorry.
Bonsoir.
Bonsoir. Oh, see, you got me there. I would say, je m'appelle Thomas.
Yes.
See?
It's a good start.
Yes,
Yeah,
it is.
it's a good
It
start.
is.
Yeah.
Because
It's a
most
good
people,
start.
when they say they can speak
caught me.
another
I was not
language,
prepared. I was not prepared at all.
it wasn't a cuss word. So as long as it wasn't a cuss
No,
word.
no, no, no,
Ah.
but thank you again, and then I will work with both of you all to get me brushed up on my French, because I want to do some traveling next year, and so I can be able to utilize it. So, thank you. That's my charge to you all.
Got it.
Right. The chair will entertain a motion.
Mais oui, monsieur, mais oui. Having heard what I've heard, I move that we send back to council with a favorable recommendation the nomination of Naomi Goma to the Refugee and Immigrant Affairs Commission.
Motion has been made and is properly second by myself. Any discussions? Having seen none, all in favor indicate by saying aye. Aye. The ayes have it. And Naomi Goma will be presented back to our city council with the favorable recommendation to be on the Refugee and Immigrant Affairs Commission. So I would say, merci beaucoup.
You see?
Yourselves.
You
Yeah.
see, it's coming. It's coming.
I just had to get a moment. You just had to give me a moment.
We'll get you there.
Thank you. Thank you. You all are welcome to stay on if you want to, or you can
Thank
go
you.
about business. And, thank you again for your willingness to serve.
Thank
Okay.
you so much.
Next up is item 2.3, Mayor Aralampalam with accompanying resolution authorizing the City of Hartford's Department of Health and Human Service to receive the funding and execute contracts and contract amendments with the Capital Region Council of Governments, CROG. And we have our Health and Human Services Director here.
Yes. Good evening, everyone. And I used to live in Morocco for a while. So, yes, I lived in Marrakesh for a while.
I went to Marrakesh.
Oh, yeah, I lived in the
Yeah.
neighborhood of Saada. So I was
Okay.
there for a while.
Clark, I need to go, right?
You can go. You can go. Yes. Yeah.
Okay, okay. I said, oh, I think we jumped to something else. What?
Hey,
All right. Yeah, I went to Marrakesh, Fez, Casablanca, and there was one other city, which was beautiful. A great time there. But go ahead, take it away.
Sounds like you were in, Indiana Jones movie.
I know. It was a traveling vacation. It really was.
Very nice.
Then when I see you next year, I have to show you pictures.
Excellent. Yes, I want to see him.
so this particular grant is referring to the Emergency Preparedness Coordinator position or grant funding. And really that grant funds the Emergency Preparedness Coordinator or Officer role here at the City of Hartford. Every health department needs to have an Emergency Preparedness Coordinator or Officer. That person really handles like all the planning, coordinating, and facilitates safety and evacuation meetings and plans, and also handles all the drills that are required by the grant. They develop, distribute, and maintain emergency communication protocols and documentation, especially with the emergency manager for the city. And they are the maintainer of emergency contact trees, emergency response. So anything immediate emergency response that the health department is responsible for, the emergency preparedness coordinator has prepared a plan for that. So if there is a natural disaster, right, what is the health department responsible for in that particular situation? If there is an infectious disease outbreak, what is the health department's role in the emergency response? That is the responsibility of the emergency preparedness coordinator. So that funding covers that person's salary as well as the activities that the department must do to fulfill the grant.
And how long is this grant for?
So that grant, I believe, is an annual grant, but it is a non-competitive grant. So we get that grant every year. It is not something that we have to apply for.
And with this grant, does that cover anything other than a salary? Does it cover benefits or that type?
It does cover it. Well, yes, it does cover salary. It does cover benefits. I believe, I don't want to say 100% on that, but I know definitely the salary, and it covers the exercises, the emergency preparedness exercises that need to be done annually, such as the full-scale exercises and drills. Also, it covers membership to NATO.
Now, with the exercises and drills, how does that go about? Is that obviously that's something that you all plan internally, but is that announced to the city staff, or is it something done like a fire drill where it's just on the fly?
It depends. If it's a quality improvement project that the emergency preparedness coordinator felt was necessary. So we did have a quality improvement plan that was created, and then there was an exercise that went along with that based on an incident that happened in our department. So a plan was created based on the incident to improve safety. So those are exercises that, you know, in terms of materials and those type of things, the grant does cover. But exercises that fulfill grant obligations are things such as citywide exercises. So for instance, I know that we fulfilled a full-scale exercise during COVID. And so these full-scale exercises are not required every single year that you have the grant, but it may cover like 2 or 3 years. And that usually is not just for the city of Hartford, but usually includes the region. So we have a regional coordinator for, you know, the greater Hartford area. And that regional coordinator will coordinate with the emergency preparedness coordinator of every town. And we usually do a full scale exercise together. So that means that if there was an outbreak, that we just don't, you know, handle that on our own, but we handle it as a region. And so these full scale exercises are done so that we can utilize all the resources in that region. And that we're prepared.
Okay. Councilman?
Thank you, Mr. Chair. And so, Director, I assume that this was actually built into your budget. The grant funded position when we passed all of this back in May.
It is.
Okay. And so this is something that's been many years coming to the city, and we expect it to continue, I take it.
Yes, this is something that's been here. This is a mandate from DPH that every health department has an emergency preparedness coordinator.
Well, let's hope we don't have to, you know, make dramatic use of it, but it's good to know that we've got the, you know, got the infrastructure. So should something happen, at least we're prepared. So thank you. I have no other questions, Mr. Chair.
Thank you, sir. The chair will entertain a motion.
I move to send this back to council with a favorable recommendation.
And I'll second that. Motion has been made and properly second to move this item back to council with a favorable recommendation. Is there any other discussion? Seeing no discussion, all in favor indicate by saying aye.
Aye.
The ayes have it. This item is passed and will be brought back to council to be taken up at our next council meeting. Actually, Councilman, let me, can we just go through the rest of the, if you don't mind, just going out of order to save item 2.4 for last?
Sure.
Okay. So item 2.5, Mayor Avalampalam with the company resolution authorizing the City of Hartford's Department of Health and Human Service to receive funding and execute contracts and contract amendments with the State of Connecticut's Department of Public Health. Director Jackson Shahid, sorry.
Yeah, so this particular grant is the ELC grant. This is the Epidemiology and Laboratory Capacity Program. And this basically provides funding to health departments to detect, prevent, and respond to infectious disease outbreaks. This grant covers currently salaries for the clinic, as well as anything that has to do with laboratory response and epidemiology. So that's what we mainly use this particular grant for. It also covers any type of equipment or tools for the clinic when it comes to, you know, anything from what the lab uses, you know, equipment that they need, you know, ELC will cover that. This grant actually is ELC 2. So we had ELC 1 and ELC 2. So this is ELC 2. We are supposed to have this grant for another year. And this funding was given to local health to kind of get us back on our feet during COVID, and then dealing with the after effects of COVID and how we need that support and funding. So we'll see, hopefully, by the state, what the funding looks like after ELC2.
Thank you. So I see that you, under this grant, you have partners, Hispanic Health Council, Harriet Health Services, Latino Way, iHeart Media, and Charter Oak Health Center. So what are these partners going to be doing?
So some of those partners are carryover from ELC1. So for instance, there were certain requirements that the state had on local health. Like for instance, if we're going to be giving out vaccinations, how would we be reaching people, at home if they're homebound? So that's why you see partners like Harriet Home Care. You see partners like Latino Way. They are a communications firm. So if we needed to do any campaigns for vaccines, for immunizations, for anything that, is related to infectious disease, we actually have funding that is in this grant allocated for marketing. So that's what that partner is for our communications and marketing. So this grant really does encompass a lot. It's just not for salaries, but it, takes into consideration what we need to get jobs done. And so, that's why you'll see different components throughout ELC. But ELC is all of the requirements are specified by the state. And so that's why you'll see a variety of different partners.
Okay. Councilman?
Sure, thank you. Director, just ELC, what does it stand for?
It's the epidemiology and laboratory capacity
Okay.
for prevention, control of emerging infectious diseases.
And so when is this the kind of thing when there's for instance, summertime comes around and there's a concern as to whether mosquitoes might be carrying disease, it's your department that starts testing water and animals and whatnot to see if these things are existing in the Hartford environment?
So we could pay mosquito control under ELC grant because that it has to do with epidemiology, right? And infectious disease outbreaks. So we could cover, and we do cover certain protocols with the ELC funding. But most of the time when it comes to anything that's environmental, we do like to separate that because the ELC funding is temporary. So that's not something that's permanent. So we don't want to put something that we know that the health department is responsible for long-term for a short-term grant. So mosquito control is not the best example because we usually pay that out of either general fund or per capita. Most of the time it's per capita because that's an environmental issue. That's something that we have to do, all the time. So we wouldn't, we may cover it under ELC or we could, but that is not proposed under this particular grant.
So this really came about as a result of COVID then?
Yes, this came as a result of COVID. So they gave us the funding during COVID and they called it ELC1. And it was just to address the public health needs and supporting really our response and our readiness and also to help us with our workforce. Because at that time, we needed additional staff and really cities were overwhelmed with funding. So the state gets this money federally, but this money is coming down the pipeline to assist local health with workforce.
So we're sort of through the heavy duty testing for COVID, I would expect. So what's the department doing at this point in time?
Well, we're still doing clinics for we're still doing immunization clinics. So we still have that. We also are paying community health workers with this funding as well. And community health workers are imperative to health departments because they are the relatable workforce that we have that relates directly with our community. So when we're talking about transitioning from this pandemic mentality into now what we consider normative status, we definitely need community health workers to, be able to communicate some of these the issues that we're dealing with, when it comes to public health. So we're still funding very important positions with this funding. And it's specifically for the clinic. So we still have our public health manager who is working in the clinic, and we still use the funding for things like communication. So it's very much a fabric of disease prevention in our department. And we're just waiting to see what support we will continue to get for our clinic moving forward.
So I take it, I know, we're still now on an annual basis developing a new strain of COVID vaccine. And are our clinics then administering the latest COVID vaccine?
Our clinics do. We do have a partner with, where we get our supply for pharmaceuticals. And so we do purchase those products and we offer them in our clinic as they arrive.
How's been the response this year? Are people coming in and get, I know I at my advanced age, I'm getting a seasonal flu shot, but now I get a seasonal flu shot and a COVID shot every year.
Well, we recently had a campaign where the governor was here a couple of weeks ago, along with the lieutenant governor and a couple of senators, and they came in to get their vaccination. So
oh, nice.
That was
Okay.
very positive.
Yeah.
And we have had a couple of vaccination clinics that we've done in the community recently. So we were on the decline for a bit, but I think that it's starting to pick back up with the presence and the new marketing that's coming out about getting vaccinated. So it's that time of year, where everybody wants to be out. It's the holiday season. People are going to be traveling a lot. And so, definitely we're pushing that message out that, we want to go ahead and improve our vaccination rate. So we have, been doing a couple of clinics.
Well, I wish you a lot of success with that. Thank you. I have no more questions, Mr. Chair.
Thank you.
Thank you, Councilman. I'm all set myself. The chair will entertain the motion.
I'll move to send this back to council with a favorable recommendation.
And I second that. So the motion has been made and properly seconded to send this back to council with a favorable recommendations. Any discussions? Seeing that there are no discussions, all in favor indicate by saying aye.
Aye.
Ayes have it. This item is passed and will be sent back to council with a favorable recommendation. Moving forward, that was item 2.5. Item 2.6, Mayor Amalampalan with the company resolution to accept a grant of $142,758 from the Connecticut Department of Transportation to create a robust car seat safety program to be affiliated with Safe Kids Connecticut.
Yes.
Madam Director.
Sure. So this is our car seat program that is housed in our MIAP department, maternal infant outreach program. And we have clinics that we do here at the health department, which basically educates community members about the proper way to use a car seat. So we actually help parents install car seats properly in their vehicles. We show them exactly how to strap children in. That's what the clinic is about. And we also, through this funding, are able to provide parents that come to the clinic with new car seats for their children. So we are providing brand new car seats for parents through our program. So honestly, it's been a very successful clinic that we do weekly. And we are looking forward to bringing that out into the community now that we have our mobile van up and running, where we actually will advertise the zip code and the location of the clinic, and we'll be bringing it to the community. So we won't just have the clinic standing here anymore where people just come to us, but we'll be going to them. So yeah, so that's what this program is about. Car seat education.
And what are the hours for that mobile van? How frequent are you on the road?
So our staff uses it all the time for outreach. But specifically for this clinic, what we're trying to do is all departments that do outreach, we want to make sure that they have a schedule. We're building a schedule currently so that they can do their outreach at least once a week in the community with using the mobile unit. So that's going to be across our departments, not just the clinic. So anyone who has led outreach, you know, our maternal child health, you know, outreach, and then we have obviously our clinic.
Okay. Do you have a number that you have done this clinic with for families last year?
In terms of how many families that we've reached or?
Yeah, for this car seat program.
I don't have that number on me currently, but I can get that number to you and
Okay.
send.
Do you have like a projected number for this year? How many people that you're expecting to participate in this program?
I'll get that information to you as well.
Okay, thank you. Councilman?
And Director, is this, when we talk about this clinic and the outreach, is this also the clinic that's doing the same outreach for what we discussed in the prior matter, the vaccines and whatnot?
Are you talking about the car seat program?
When you talked about, yes, you talked about going out into the community with this. Is that in conjunction with other things, or is this just the car seat program going out by itself?
So this would be the car seat program going out by itself, but the car seat program could go out in conjunction with the MyApp program. So say the MyApp program is having an event per se, and then they want to attach the clinic to it. I mean, we have done that before in the past, but we really want each department to kind of have their own time to do outreach with the mobile van. We don't really do so much overlapping unless it's, you know, in a city-wide event where we have, you know, all of our different departments coming out, giving information to the public. But for the most part, we want to kind of have, I mean, because it's only one unit, right? So we want to make sure that everybody gets a chance to use the unit. And programs are different, funding is different. So, you know, it really is a standalone. It's especially since that clinic, as right now, how it functions, it's a standalone clinic. It's not something that is done with another program.
Got it. Okay, thank you.
Well,
I have nothing else, Mr. Chair.
Thank you. Neither do I. The chair will entertain a motion.
Move that we send this back with a favorable recommendation.
I second that. Motion has been made and properly second to move this item back to council with a favorable recommendation. Are there any discussions? Seeing that there are no discussions, all in favor indicate by saying aye.
Aye.
Ayes have it. This item is passed and moved back to council for a favorable recommendation. And I would leave us our last agenda item. Let me get back to it. Is item 2.4, which is a presentation by our Director of Health and Human Services.
or if I can just share
Sure.
my screen. Can everybody see this?
Yes.
Yes, we can.
Okay. Okay, so this is going to be a brief overview just of the health department. I really appreciate the opportunity to present this overview. We asked for this presentation due to our FAB accreditation, which requires us to communicate what the health department actually does and their divisions and how we are serving the city. We also have included just a special slide that, talks about relocation as well. Because I know that that was something that was inquired about. So just very quickly, the Health and Human Services mission, the Department of Health and Human Services aims to protect the well-being of Hartford residents, to promote an environment conducive to healthy lifestyles, and to prevent adverse health outcomes through needs assessments and the provision of quality services. Not many people know that our department functions using the 10 essential functions of public health, or the 10 essential public health services. So everything we do it through this lens. We have our assessment phase, our policy development, assurance, and everything, all of our program development. We all look at that from an equity lens. So those of you who are familiar with the 10 essential public health services may have noticed that this is new. Equity was not at the center. Previously, it was research, but that was changed to equity. So basically what we do is we monitor health statuses to identify and solve community health problems. We diagnose and investigate health problems and health hazards in the community. We inform, we educate and empower people about health issues. We mobilize community partnerships and action to identify and solve health issues. We develop policies and plans that support individual and community health efforts. We enforce laws and regulations that protect public health and ensure safety. Most people do not know that the health department is actually an enforcement agency, but we are. We link people to needed personal health services and assure the provision of health care when otherwise unavailable. We assure competent public health and personal health care workforce, and we do that through workforce developments. We evaluate effectiveness, accessibility, and quality of personal and population-based health services, and we do research for new insights and innovative solutions to health problems. We have recently hired our other senior epidemiologist, which we are very excited to add to our staff. She comes to us with years of experience as a local health epidemiologist, as well as experience working at the state level. And she is also currently in the military. So we have someone very dedicated to serving our country and to epidemiology and disease prevention. So we're really excited to bring in more of this research component. So this is our organizational chart. And I think a lot of people get really surprised at all the divisions and the way our department is devised. So we have our administration and grant management. We have environmental health. We have senior and community services. We have our maternal and child health. And we have our disease prevention and health promotion. So we have quite a few programs. We have, most of our department is funded by grants. We have our budget is a little over 17 million. And we have a little over 6 million of that is from general fund. The rest is grant funded. So this is our department and how it's devised. Okay. So within the senior and community services division, we have a program called relocation. And relocation technically is under the community services department. And the senior and community services department falls under the human services portion of the health department. So technically it is the Department of Public Health and the Department of Human Services, but we function under the same leadership. So relocation is technically under our human services side of the health department. And I just wanted to go through the process of relocation because I know that that was something that was requested. How does someone in our community get relocated if there's a fire or if there's an environmental issue? So first of all, if there is an emergency, if there's a fire, someone, you know, is going through an emergency, they get an intake from the American Red Cross first. Everyone does that in the entire state, no matter what city that you're in. The American Red Cross comes in, does an intake for the resident, and they get 2 days in a hotel. So 2 days in a hotel, and they get vouchers for food and whatever other services the American Red Cross offers them. After that 2 days is over, then they are passed on to their local municipality. Okay, and so how that process begins is we get either a temporary or permanent vacate letter from LNI, and LNI is licensing and inspection in DDS. Once we receive the temporary or permanent vacate letter, the person is then turned over into hotel relocation for the city. Now, if the person is already relocated in a hotel from American Red Cross, then we just go ahead and begin the intake process. If they have not, and they are not in a hotel from American Red Cross, then they go into the hotel relocation that we set up for the individual. After they are into the hotel, then we go ahead and do our intake process. And our intake process really is an application. So it's a packet of documentation that we require for the actual program, as well as resources. So we let individuals know where they can get food, where they can get possibly clothing if they need it, if they need, you know, documentations or documents that have been burned in fires or anything. We let people know where they can get duplicates of that information as well. After that intake process, really it is a resident driven program. So we do not, although we do offer resources for apartments, it is not the responsibility of the health department or the Health and Human Services Department to actually find an apartment for the resident. The resident finds an apartment on their own, because obviously we do not know what their budget is and the needs of their family. So they would have to find the apartment that's best for them. What we are asking them for is the approval letter from the new landlord. Once we receive the approval letter from the new landlord that they have gotten approved for the apartment, we give them a commitment letter for the relocation program, letting them know that we are committed to giving you up to $4,000 for relocation. Once they get the commitment letter, we ask that they give us a signed lease from their new landlord, the W-9 form, which is, it says it's a W-9 form. And that W-9 form just lets us know that it's a legitimate business. All landlords have a W-9 form. And on that W-9 form, it also lets us know where we are going to send the money, the address where the landlord resides, and a CAO if applicable by LNI if it's needed. Once we have those documents completed, that documentation gets sent to finance for payment. We do not finance any of the applications. The City of Hartford downtown finance office actually sends out payment. So once that documentation is complete, our job is to pass it over to finance. Finance pays it out to the address that is on the W-9 form. So the payment does not go directly to residents. It goes directly to the landlord, the new landlord. And we ask everyone to allow a payment to process for up to 10 business days. So we let people know that from the time that we receive your documentation and we send it downtown, please allow 10 business days for the payment to be received. And during that time, not only are we in communications with the landlord, we're in communications obviously with the tenant. So the landlord knows about the process. The landlord understands about the processing and what the wait time is. And we usually, you know, have very, very few cases where there's an issue with payment receiving. And that is our relocation program. This is just a small composition of staff. We prioritize representation and staff diversity. So we just included a small chart of race and ethnicity and gender. What we're doing right now is we're really trying to make sure that our staff represents the community that it serves. So we definitely are prioritizing diversity. Some of the strategic initiatives that we're working towards, we're completing the accreditation process with the Public Health Accreditation Board. The application was already accepted, and we do have an extension for a year to January 1st of 2025 for all documentations to be uploaded and for review before we get a site visit. Develop and deploy comprehensive rodent control plan for the city. We actually have completed that. And I'll tell you a little bit more about that on the next slide. Move from the pandemic phase to the endemic phase as it relates to COVID-19 while continuing the response for flu and RSV. Identify additional funding sources to expand the department footprint in areas identified in community health. Implement workforce development plan with state funding, which we do have a workforce development grant for 4 years. So we have $218,000 that we have per year for workforce development. And we can talk a little about that if anyone has any questions on how we use that funding. And implement sexual health program throughout the department clinic. So some of our highlights that we've had already for this year. So our rodent control inspection unit is redefining rodent control planning around the state. And basically our program is currently being used as a model. So we were asked to do a presentation in Mystic before most of health departments and the state, as well as people in New England with organizations, within New England. And we have gotten so many calls from other municipalities for our rodent control plan. We've also got some recognition, some media recognition for it. And honestly, that is all, related to our new machine that we're using for rodent control. It really is very transformative, and a lot of towns are asking us what we're doing. So we're getting a lot of recognition right now for our rodent control plan and how successful we have been. So we continue to refine deployment of existing strategies and identifying new strategies to control the rodent population. I know that for the previous administration, that was really a priority. And for the current administration, it continues to be a priority. So I'm really happy that we were able to make strides for rodent control in the city of Hartford. Our public health accreditation board application was accepted and an extension was provided until 1/1/25 for review. We also recently sent out a bid out for grant writers for a new $2 million grant that will benefit senior landlords. And if anyone has any questions about this new grant that we're applying for, we can talk a little bit about that, but we are really excited because this will help some of our senior landlords in the city with fixing up their homes. So not just if you have lead, but if you have other exterior issues. This will be some funding, a pot of money that, seniors will have available to them to help them out with fixing up things around their house. Our warming centers this year will be open by December 1st. I know that last year there was a little bit of an issue with a delay in warming centers open. So we're going to be opening them up earlier this year by December 1st. And we created an internal culture and engagement committee. And this was done after we completed a survey to our employees to talk about the culture of the department and also engagement and recognition. And so we created an internal committee so that we can, proceed to change the culture of our department as we move through and put in standardization. And so our budget highlights and areas of focus, obviously it's promotion, promotion, promotion. So HHS strives to promote from within. Our funding, HHS continues to pursue new grant opportunities as capacity and needs arise, and for social determinants of health, finding opportunities to engage in this work through partnerships. And we just highlighted advocacy because we really are stepping it up with advocacy. I think that a lot of the organizations that we're partnering with are doing great work in the community. And so we're definitely here for it, especially, with our new employees that are, new to public health. I think that it's important to make sure that they have a good grasp on advocacy. A lot of times we don't really have, we do a lot more regulation But we really want to get into advocacy and help out with that policy, with things that, have to deal with policies. And that is it for us. Does anyone have any questions?
Thank you for your presentation. Regarding the warming centers, what's the location of the warming center? Are they going to be at the senior centers again?
So I can send you all the locations for the warming centers.
Okay, that'll be great. So we can get that out early. And regarding the relocation assistance, that funding, where do we receive our funding for that? Is that budgeted through our general fund appropriation, or do we receive monies through the state and federal government?
So it's both. So the majority of the funding is from the general fund, but we do receive CDBG funding for relocation as well, which CDBG funding is it's very limiting on what we can use the funding for. So it's specifically for relocation, and there's a lot of, stipulations. General fund, obviously it is for the relocation program, but in terms of how we use the funding, it's a little bit more relaxed because it comes from the general fund. But the majority of our funding comes from general fund.
Okay. So do you know what's been the common budgeting practice for the amount and the line item that's used for relocation for the general fund? How do we determine what's an appropriate dollar value?
So, so that question is probably, would be probably better for finance or budget and management. But what I would say is annually, there's an amount that usually we use. So, they usually determine the amount of funding based on usage from previous years. And then what happens is, some years you can get more fires. Some years, you don't really have any, or you have less. So it's kind of like a rollover as well. If we don't use the funding from previous years, then that kind of, goes into our budget for the current year. And we do not receive the funding all at once. So basically, how we pay for relocation right now is for the hotels, we use a P card. So our department has a P card. So we charge the P card for the actual hotel stay. However, when it comes to the permanent relocation funding, that all is, given to the landlord through finance. So we don't really see that portion. The only, portion that we really deal with when it comes to finance is the hotel stay.
Okay. And is it your department, or is that handled through the administration that works on the negotiation for rates and the selection of motels for the relocation?
So, so from what I've been told, there was an assessment that was done a few years ago on how much hotels are, right? And what we could actually afford. So there are categories, obviously, to hotels. Previously we had used hotels that we try to stay maybe 120 and under a night for hotel stay. But recently I know with one of the cases that we've been dealing with, we've kind of revamped our policy in the hotels that we're offering to residents. So we are now in the bracket of $179 a night. Between like 100 and I would say 150 up to like $180 a night. is what we're paying for hotel stay currently. So that's where we are right now.
Talking my language now. That's that's yeah, that's quite a jump. So that will actually, if I'm hearing you right, with the increase of prices, that kicks things up a notch, and that puts the hotel stays into a different category as far as the location that they're in, correct?
Exactly, yes.
All right.
I mean,
Okay.
we do still have quite a few residents, that would prefer to stay in some of the hotels that are under 100. And that's because there are, less stipulations. So a lot of those hotels, allow residents to have pets.
Mm.
So if somebody has a pet, if you're at the Candlewood, that's not an option, right? They don't allow pets at the Candlewood. So if that's a hotel.
Recording stopped.
Sorry, go ahead. You may.
Oh, okay. So if that's a hotel, where we're at, they don't allow pets. However, if we're at another location, they may allow pets. So some residents prefer to stay at other hotels.
Okay. And so you said that that's interesting, and I forgot about that. So the Red Cross at every fire where there's relocation assistance, they come out to do an assessment as far as intake, correct?
I'm sorry, can you repeat that?
The Red Cross, they are the ones that do the intake of the initial intake of the fire victims who are have been displaced and have put up in temporary housing.
Yes, they do the initial intake of the individuals. They actually put them in hotels for 2 days and give them food vouchers. And then the residents are passed over, to us, if they want to be in the relocation program. So some residents don't want to be in the relocation program. They decide that, okay, you know what, I'm going to stay with family, or, I have other plans, or some of our residents do have renter's insurance. So the 2 days that they use from, American Red Cross is enough for their renter's insurance benefits to kick in before they can make other plans. However, there is still a considerable amount that do decide to house with the health department. And so what we have been doing currently is we don't control the hotels that obviously American Red Cross uses. So if American Red Cross uses a certain hotel and we're not offering that hotel anymore, then we offer what hotels we are offering to the residents and give them the option to go ahead and move. If the resident does not want to move from where they are currently, housed in a hotel, then we also, give them the option to continue with the relocation program, and we'll pay for that hotel. Because we don't want to, make someone uncomfortable.
Yeah.
If that's what their preference is.
Yeah, that's understandable. Do you know if regarding renters insurance, if that is if that is something pushed by landlords to provide as soon as they get a new tenant, or if they have, they have or their regular tenants, is that something that they actually promote, encourage tenants to get renters insurance?
So I don't know if every tenant, every landlord is expressing the need for renter's insurance. I know that some landlords make it a part of the lease that you have to, show that you have renter's insurance. That is a common practice. But there are many landlords that, do not require renter's insurance or do not push the issue of presenting the proof that you have renter's insurance. But I do know that our fire department does talk about renter's insurance when they put in,
Alarms,
I'm sorry.
smoke alarms.
Yes, the smoke alarms, the smoke detectors, they do discuss our renter's insurance. And also with our new fall manual that was put out through Janice Castle Department, there is a not really advertisement, but a page in there that, talks to residents about or informs residents about the importance of renter's insurance. Because renter's insurance is really not expensive, and I just think that people don't really understand or know how much it really is. But really that is extremely beneficial because it really can help in an emergency.
It is, and that's something that we still have to figure out a way about how to communicate to residents regarding the critical need to have renters insurance and find some way how we can work with the landlords to enforce that. Councilman, I don't want to monopolize everything.
Monopolize away. Thank you, Director. Greatly appreciate the presentation. And just following up on some of the relocation questions, what under the law, what is the requirement? How long does the city have to house somebody who's been displaced?
Well, I would refer that question to our attorney's office because our attorney has been working very closely with our policies, our legal policy, and knowing exactly what the requirements are. So I don't want to, give you incorrect numbers. So we can give you that information at a later time.
Well, I think we have the city attorney, the relocation expert is our counsel, Damar Osborne, who's on this call. So maybe Damar, later on, you can chime in on that. Sticking with relocation, when we were talking about funding sources, and again, this may be a Damar question, but if I'm not mistaken, the city also has the ability to collect from the landlord or from the landlord's insurance policy anytime that there's, well, I don't know about any time, but under certain circumstances, they can collect for the cost of relocation. Isn't that right?
We do that. That is a part of relocation. We have an individual who handles the financing portion of relocation, and that is part of it, is recouping what the city has put out in terms of financing. So there is a portion of the policy that talks about liens on properties, which our department works closely with our legal department in enforcing liens on properties if those costs are not paid for. So there is a portion of the policy that does discuss recuperating city funds. But there are also barriers at times to recouping that, because you're dealing with landlords who could possibly sell a building right after an incident, and then so now we might have some difficulty recouping some of those funds. But there is a process to recouping funds that the city does pay for relocation.
Yeah, I think it'd be interesting. I mean, I wouldn't expect you to necessarily have these figures with you, but I think it would be interesting to see the extent to which we are in recoupable events, the extent to whether if it's a recoupable event, are we collecting 50% of those? Are we collecting 70%? Are we collecting 20%? And again, that may be a corp counsel. They may know more about that if they're
Well, we
involved.
do have figures, if you wanted to know, what the figures were for, last year and, the year before that, in terms of how much we spent on relocation and then how much money we recouped for relocation. We can get you that those figures, and we can put it in a nice table for you and present that to you so that you could see exactly, are we getting 100%, or are we, typically getting, 60% of what we're paying?
I think that would be very helpful. So,
Okay.
so thank you. If you don't mind, yes, that would be very helpful. Now, one other thing that came up in relocation recently, there was quite a bit of discussion about some folks that had been unfortunately unable to find replacement housing quickly, and were therefore in continuing to receive relocation benefits from the city. And as I recall, one of the issues was that at some point in time, a hotel might not be, or a hotel without a kitchen might not be compliant with the law. What can you tell us about that?
I would refer that question specifically to council about, if it's legal, to have a kitchen or not. Some hotels have kitchens in them. within the city of Hartford, some don't. So I think, you know, just because a hotel doesn't have a kitchen in it, doesn't mean that we still don't have the obligation, you know, to house the individual, right? If there's an emergency. So I think, you know, if they have kitchens, it's a benefit. But I don't think necessarily that it is 100% of a requirement, especially, you know, if it's between the person not being housed and then being temporarily housed. But that is a question in terms of legally, that I will refer to council.
We're filling up, Attorney Osborne's plate here. Thank you. Moving on to the shelter question
Mhm.
that we discussed a little bit about. Are they are there, is like the McKinney shelter, I know that's a city-owned shelter. Is that under your jurisdiction?
So, McKinney Shelter, we pay for the operations. Yes, so we pay an organization to actually run the shelter. And then, you know, we pay for the operations of the shelter.
And in terms of other shelters, are there any other shelters that are run by the city of Hartford at this point?
I do, no, I think that it's McKinney Shelter is under, like, that's under us, like City of Hartford. We do, deal with, what is, I'm sorry, the South End,
South Park Inn.
yeah, South Park Inn. And
What
I
about
think that's,
Immature?
I'm sorry.
Do you have any dealings with Immature?
That Elizabeth House, St. Elizabeth House?
No, in the Elizabeth House, I know they merged. I'm sorry, they merged. Then they merged with my sister's place, but Immature is right there on corner Park and was that Hungerford? Oh, sorry, Park and Grand.
Well, they don't get funding from the health department. If they're
They,
getting
they
funding
don't.
from the city,
Okay,
then, you know, that may be separate, but the shelters that we actually fund from HHS is McKinney Shelter.
but do we partner with all the other shelters in the city, such as Immature and St. Elizabeth House?
I honestly, if we're talking about, you're talking about for like homelessness or a displaced service. So that would, I mean, obviously we go through the 211 system. So we really don't have a specific shelter that we're partnering with to find people. And we don't really find, you know, we can't like find people sheltering that way because we're within a state that has a specific protocol for, you know, housing displacement. So I mean, everyone goes through the 211 system. So, you know, we can't say that, okay, you know, if you're letting us know that you need housing, oh yes, we're going to place you in that shelter. That's really not the role of the health department. Everybody goes through 211 and then 211 actually finds beds for them.
So, so where in the city then would it fall to the responsibility? Where would the responsibility fall to sort of analyze the city's needs for shelter and make a determination as to whether the city needed to, for instance, acquire a second shelter or add additional beds?
Well, there is a leader in the city of Hartford for the CAN. And that organization is leading the homeless initiative for the city of Hartford. And that organization is Journey Home. So they are the leaders to the CAN. Now, I don't know if they would specifically, I mean, they can recommend, right, that, okay, well, we may need another shelter. But they are really leading the charge for housing displaced individuals. What our responsibility is right now is we do handle encampments, right? So we do have, you know, someone in the health department right now, Patricia McIntosh, who is my deputy director of social services, who is, you know, currently dealing with encampments at the city. So, you know, we recently formed a task force that, you know, handles, you know, encampments. And we do discuss issues about sheltering and these things, but, you know, we are really focusing right now on the encampment piece.
So the task force you mentioned, who are the participants of this task force?
So the participants are all of the departments that currently deal with the encampment protocol. So that is, HHS. We have the police department on that call. We have upper administration. I believe it is DPW.
Okay. I'll put my Larry Deutsch hat on for a minute. And I don't know if you had the pleasure. I'm not sure if you were a director at the time, but Councilman, you can see Councilman Clark is getting a kick out of it.
Oh man.
But Councilman Deutsch was very, very concerned about nail salons in Hartford, and
Yes, I've had the pleasure of
okay, so
being
so I'm
introduced
just
to him.
I'll ask the Councilman Deutsch question. How are we doing with licensing the nail salons at this point?
Well, we do have a sanitarian who that is her special project. She does cosmetology. So she is handling the licensing of our nail salons and barbershops. But I will say that at some point, when we do change the ordinances, because we do have to make some changes to ordinances when it comes to what we will be enforcing. I do think that we need to discuss some sort of funding initiative for nail salons, because the equipment that we are requiring or asking them to have that will assist with environmentally friendly nail salons and helping with the emissions, it does come at a cost. And so especially for some of our buildings that have already been grandfathered in with code that may not have the requirements that is needed for special equipment, we're definitely gonna have to talk about some, funding for businesses, because is it fair for us to now say, because of these, particular health concerns, we requiring you to have a $30,000 nail booth, to function and be licensed in the city of Hartford. I mean, that's a pretty big ask, for a small business. So, right now we are licensing under, the current regulations. But if we do change, to some of these, more environmentally friendly, requirements or regulations, then it will come at a cost to our small businesses. So, definitely the chief sanitarian is trying to look at options and how other municipalities across the country, not just in Connecticut, because Connecticut, with this is a little behind, but across the country, and how they have handled what they're offering to these small businesses.
Well, we'll look forward, on council, we'll look forward to seeing what comes from the administration on that, and happy to entertain it. I mean, we're obviously there's cost benefit analysis to everything, but public health is certainly everyone's concern, and so if it's something that we should be doing, I guess we should be doing it. Couple of other kind of enforcement things. I'm just wondering how how these things are playing out at this point. I know pre-COVID, there were a couple of initiatives statewide that got great support initially, and then all of a sudden COVID hit. One was the plastic bag ban, single-use plastic bag ban, and then I everybody was getting with the program, and then COVID hit, and it was kind of relaxed for a time being, and I'm just wondering if you have any sense of whether we're getting 90% cooperation on that, less, more, what you're learning from your department.
So what I can say with the plastic bag ban is as our inspectors do go out and do their inspections, if they do see plastic bags, being used, by businesses, you know, they are informed of the ban and, you know, definitely, you know, informed or given the information that they need to, you know, not use, the plastic bags. I mean, we're getting mixed reviews across the city. You know, some businesses, you know, all you have to do is tell them, you know, one time, right? And then it's 100% compliance. And then you have, you know, other businesses that are a little slower in following regulations. So when it comes to the plastic bag ban, what I've seen is, you know, if we inform businesses, if we do see it, and I think that they know, but I think that it's just, you know, it's habit when you're purchasing materials for your business. It just may be habit, but most of the time when we inform a business that, hey, listen, there's a ban on plastic bags, you shouldn't have that. You know, most of the time, you know, the next time we go in, they're not using. So it's just a matter of, you know, getting to all the businesses and our new businesses that are popping up and just breaking habits. So, you know, that's what the campaigns are for. And so, you know, we are trying to get, you know, a schedule and create more community, I don't want to say advertising, but community informational videos on various public health topics and put that out, you know, into the media. And that's something that we've been working on, especially since we really would like, you know, there to be a communications department here at the city of Hartford. I mean, that's something that I have been advocating for a while. I know that there is a new communications assistant, but I do think that, you know, the city of Hartford, we are the capital of Connecticut. And I know for, you know, some municipalities that I've seen, I mean, they have very, you know, they have a full department for communications. And so I think that that would be, you know, extremely helpful. We're working on getting a PIO for health because we're forward in the community and we put out a lot of information and campaigns, but it's very expensive to keep, you know, using grant funding for large campaigns for one particular area when we could literally be using that funding for a position, right? And actually having someone who we don't have to keep, you know, using communication firms, but actually have somebody here at the city who, you know, is a communications, that is what they do.
I've heard you talk about that before, and I certainly appreciate the sentiment. And last question, kind of along those lines. I know you and I have had some discussions about gun safety and getting the, you know, as we've been talking about, getting the word out on various things, getting the word out to our residents to be more alert when it comes to gun safety. Has there been any more thoughts on moving ahead with any kind of program in that regard?
Well, what we have done is exactly what we talked about in our home visiting program. We do talk to families about gun safety. And so that's something that we've done here, and especially to our families that have children. So that's where we have started. It's very difficult for us because, you know, it's not under our purview, like we had discussed previously, to go into the hospital settings and require healthcare professionals or providers to add anything to their already lengthy assessments. So it's more applicable for us, you know, to go ahead and work with our education programs that we do in-house. And then try to partner, you know, with other organizations that's something that they prioritize, and maybe see how we can link up and work, you know, that's where the advocacy work, you know, really comes in. And that's what we're trying to do a little bit more of, because I think that we do have a lot to offer being, you know, at the local government level. And we're trying to, you know, get more involved with that. But I am going to an event November 13th. I was just invited, and I actually connected Siobhan with an old colleague of mine who's now the executive director of this organization in West Hartford, um, who is in charge of, their gun violence prevention program. So I was invited to this regional event. So we'll see, what they have to say and what they're doing and how we can possibly take some of that information and implement it here at the health department.
Well, good luck with that, and thank you for everything that you do. You've got an enormous department, enormous amount of responsibility. It's quite a big tent that you have there, and so certainly appreciate it. Thank you, Mr. Chair.
Thank you, Councilman. And Director, thank you very much. I know the hour is far spent, but I believe that this has been a productive conversation. And separately, I would love to talk to you about maternal health, more so Black maternal health, and how we can get behind that to get some messaging out regarding that as well. So we'll catch up regarding that, and I want to hear your thoughts about that initiative as well.
Definitely, please come visit us. We
Yeah.
encourage people to come visit. We feel like we're like on the outskirts, right? We're not in City Hall, so any visitors we get,
Yeah,
we're
right.
excited.
Right. Well, you won't be there for long. So eventually we'll have the building erected at the corner of Albany and Woodland, and you'll
Albany and
be.
Woodland, yeah.
Yes, thank you very much. I heard.
Oh, well, quick question. Do you know when the building on further down Albany Avenue that will house MyUp, when that's going to be ready?
I have not heard.
Okay. All right. No problem. All right. So if there's nothing else, Councilman, you wanted to say something before we adjourn?
Yeah, this is just between you and me, really, as a committee. Director Jackson's welcome to hang around to listen or not. I mean, it's interesting because she just spoke about a task force that she's involved with, looking at the whole issue of homelessness, and that's what I wanted to talk about. And what I wanted to talk with you and other council colleagues about is whether we think there'd be a benefit to us at the council level trying to put a task force together to examine, homelessness in 2024 and what what efforts the city might take. Certainly it seems as though it's a problem that's not going away and not getting any better, if anything getting potentially worse. And I'm always a fan of being the one that comes up with something new and different, as opposed to doing the same old, same old.
Right.
So I don't know, I don't know if we were able to, put some folks together that are in the, advocating or in that environment, in the homelessness world, together with some administration partners. Maybe it's duplicative of something that's already taken place. But anyway, just, I mean, it's the kind of thing I think we just to start a conversation to think about as to whether it would be something that would be useful and potentially, come forward with something that's helpful in this.
No, I'm happy to discuss it. I think this is something that I've been thinking about, had some conversations with. We actually spoke briefly with Councilwoman Rossetti, since she's in kind of in that space, on what the CAN group has been discussing, which is led by Journey Home, and how that actually is going to be implemented, because I mean, I've seen it as well. The increase of the homeless population, the encampments that have been erected around the city. I know that my office had received quite a few phone calls by folks downtown as you come off of the highway, the Trumbull Street, Market Street area. And we actually worked with DOT and DPW, as well as Officer Barrett, to get those encampments removed, which they did. And that, I know Officer Barrett mentioned that was something he's been trying to get those encampments removed for a long time. But we were able to do it very quickly. But I think that, yeah, we do need to have some type of council conversation regarding this. I'm open to a task force to take a look at this, because we need to figure out as to how we can manage this. I know certain cities have done implemented other strategies, but I know that that has come with funding, and I think that's probably our biggest issue, is how we can tackle it by not adding to the expense of the general fund, and how we can partner with other entities outside that can bring some type of funding to the city where we can figure out this solution.
No, and to that point, I mean, clearly, this is not a Hartford problem. This is a state of Connecticut problem.
Yeah.
The fact that the people end up homeless in Hartford, it's not that they come from Hartford for the most part, are long-term residents of Hartford, but as the capital city, as any city, I imagine New Haven and Bridgeport are suffering from some of the same issue. So it very much so, it seems to me that this is a statewide responsibility that should not fall squarely on our shoulders. It should be borne by everyone. And to your other point of other what other communities are doing, I mean, I would love to explore things like, we have a number of school buildings that are sitting empty. Are
Right.
these buildings that could be turned into housing for our I think actually I'm using the word homeless, but I know others are now saying unhoused people. Could these be turned into places for unhoused people? And on the encampment side, could we actually set up a place where it's okay to camp?
Yeah.
And I'd love to get, but I think that would require a task force that included legal, that included maybe even some state participation. So anyway, glad that you're thinking about it. I'm thinking about it. Maybe we can put something together over the next couple of weeks to get something started.
Definitely. Matter of fact, it was the city of Atlanta that has done something with the unhoused population, where I don't know where that funding came from, but I know it was not solely on the city of Atlanta's general budget for them to take care of stuff. And and I'll send you some information regarding some creative ways to build this into more of a community for these individuals, that I think is something that we should definitely explore. And I know that with the announcement of last week between Mayor Avalampanam and Mayor Martin from East Hartford, and that task force, and I know the director, I think, is probably going to be on a committee or two, that this might be something that they can take up and look to see what recommendations that they would be able to provide us with.
All good thoughts. Thank you.
So since we have no other business to discuss, I think I can take the liberty with my council colleague, who we have been together on council for almost 10 years now, John. Can you believe it? We are.
I was a young guy. You were already an old man, but I was a young guy.
We want to encourage you to go vote tomorrow.
That's right.
You did not
Absolutely.
vote early. I voted early, and it was quite an experience with our registrar of voters office and their team, and how they were able to get people to vote. But please, we encourage you to go vote tomorrow. The polls open at 6 o'clock in the morning. They close at 8 o'clock. And please do not be dismayed by the lines. We are anticipating long lines, but please stay in line to exercise your right to vote. And the city of Hartford does do same-day voter registration. So if you are not registered to vote, please come down to City Hall, where you'll be able to register on site and vote at City Hall. And please do your level best to exercise your right to vote, because your vote is your voice and your vote is your power. So Councilman, do you have anything?
No, here, Councilman. Those are, thank you very much. Those are great thoughts. Get out and vote. Get out and vote.
Thank you very much. And it's 7:34, and this council committee meeting of the Health and Human Services Committee is now adjourned. Thank you very much. Have a good night, and I'll probably see you around the city at the polls. Take care.
You will.
And dress for the weather, please. All right. Good night.
Good night.